Deutsche Welle correspondent Nicole joins us now for more from Berlin. Nicole, restrictions are being lifted, but life isn't back to normal just yet.
Not at all. What we're seeing across the board really are baby steps. There is a great awareness of how volatile the situation is and the trauma of the past months, not only the devastating human costs of the pandemic, but also the psychological damage and the social rift that have come out of this crisis have decision makers treading very carefully. This week, we're seeing a very slight easing of curfew rules in Italy. France is winding down its third national lockdown. Greece just recently dropped quarantine mandates for foreign travelers. And England is proceeding with gradual reopening for now, that is, because there are worries about an increasing number of people becoming infected with the coronavirus variant first detected in India. Here in Germany, the situation very much depends on where you are. Regions can ease restrictions if the infection rate drops and stabilizes, something that's just happened here in the capital, Berlin, but will have to go back into lockdown if numbers rise again. So citizens are being urged not to get carried away with their new freedoms, keep up social distancing and hygiene measures to make sure this third wave of the virus really is the last.
Nicole, this week, Germany announced a shift in its vaccination strategy. How will it change?
Well, on Monday, Germany's health minister announced that starting in June, every adult over the age of 16 will be eligible to get vaccinated. That means that the current priority list, putting the vulnerable and exposed ahead in the queue, will no longer apply. Vaccines will be given out on a first-come, first-served basis to anyone who wants them, but that sounds a lot easier than it actually is. A number of states had already ditched prioritization to speed up the process, but that has often ended in chaos, with demand drastically exceeding supply, doctors' offices overwhelmed with requests, or people waiting for hours just to be sent home unvaccinated. Vaccination centers here in Berlin currently have a wait list until the end of July. I checked this morning, so infrastructure processes and vaccine availability will have to be considerably improved for everybody to actually be able to get a shot when they want one.
Yeah, so broadening access to vaccines comes with some controversy there. Why is that exactly?
Well, while this is, of course, great news for people living in Germany, looking at it from a global perspective, it begs the question of fairness. There is an ongoing international discussion over whether some countries should be able to vaccinate everybody, while some others don't have access to any vaccines, or very few just yet. A question that was also widely asked when the U.S. announced plans to start inoculating children. And that is why the organization involved in COVAX, the vaccination scheme for poorer countries, are calling on wealthier nations to donate 20% of their supplies to the program. They say that high-income countries that have bought up much of the immediate global vaccine supply could bear to share them with the less well-off without even compromising their own objectives. The COVAX initiative was thrown off its course, in part by the flare-up of cases in India. Most of the COVAX doses were to be exported from there, but had to be put to use domestically to stop the virus from spiraling further out of control there. So those who have vaccinated the most at-risk segments of society are asked for solidarity now and foresight, because the virus continuing to circulate freely anywhere will allow for more mutant strains to emerge that could eventually thwart every country's progress towards immunity.
Nicole reporting from Berlin. One of Australia's most intriguing mysteries could be a step closer